I'm going to discuss the meningiomas. Meningiomas are the most common brain tumor present in the population, and meningiomas are the benign kind of brain tumor, and it has a presentations depending on the site which they offer or where they are present in the brain. So most of the brain tumor with the meningiomas present with the unusual headache which is not subsiding with the medication, early morning headache, and patient complaining of any arm or leg weakness along with the eyesight deficit and along with the hearing deficiencies, and some meningiomas which are the present on the posterior fossa that may present with the walking difficulties or imbalance while walking. So these are the meningiomas. Meningiomas occur from the start developed from a brain epithelial, which is the brain covering is called as a meninges. That is the brain covering, and it is the surface tumor. So it is not infiltrating into the brain deeply. So these are the meningiomas which mostly present on the surface of the brain. So what are the treatment options available for these meningiomas? So most of the meningiomas, if you have diagnosed with the meningiomas, the treatment option depends on the size of meningiomas. Meningiomas is too small, we can observe for 2 years if we don't want to operate. If it is size is too large, then there is no second option, we need to operate. So operative means we need to do a craniotomy. That my craniotomy videos I'll explain what is the craniotomy. Craniotomy means with the drill and cutter we used to remove the skull bone and assess the brain. So that is after craniotomy we used to excise the meningiomas. Meningiomas mostly on the surface of the brain, and it is not infiltrating deeply into the brain parenchymas. So after the surgery, meningiomas, we excise the meningiomas for a histopathological diagnosis. On the histopathological diagnosis, if it is diagnosed as a meningioma, then also we used to examine the further IHC marker study. IHC marker studies and further molecular marker study shows if it is aggressive variant, then that patient may need to be undergone on the radiotherapy. If the meningioma operated timely and precisely, patient doesn't develop too much of weakness or patient recovered properly from that. And after the surgery, patient recovery phase is very good, and with the surgery we need to follow up this patient with regular MRI. So if any recurrence, there is some chances of recurrence with the meningioma surgeries after the surgery also. For that we need to take the patient on the surveillance. We need to do MRI every yearly or 6 monthly. If it is reoccurring, then we may consider for a radiation therapy or re-exploration of the meningiomas. Thank you.